I'm Dr. Steve Grinstead, author of the book Freedom from Suffering: A Journey of Hope, and someone living with my own chronic pain for over 30 years. Today I want to talk about what I believe are 4 important areas that need to be addressed for effective chronic pain management. The areas are biological, psychological, social, and spiritual. Let me say a little bit more about each one. When I first meet with a patient, like I've been doing for the past 29 years, I do an assessment on their quality of life in these 4 areas. It's really crucial to understand in the biological area, for example, how people are taking care of their health, diet, nutrition, exercise, dental and medical checkups. How much exercise they're getting is really important. I rate each of the quadrants on a 1 to 25 scale. On the low end, if somebody was down at a 1, 2, 3, they should probably be in the hospital, maybe even in the intensive care unit. Now, if they're up on the 25 end, they're ready to go out and run a triathlon. So I ask people, where do you think your score is? And then tell me why. Then we move into the second window, the second area, which is the psychological. This is our ability to manage our thoughts and emotions, how to identify and manage self-defeating patterns of behavior, for example. Now, same 1 to 25 score. If somebody's down at the 1, 2, 3 end, well, it's back to the hospital, but a different ward this time, the one that has padded walls maybe. And if they're up at a 25, that means they've achieved enlightenment. They're a guru status. And I want to find out what their score is, and then have them share with me why they believe that. Then I move to the third area, which is the social, their connection with family, friends, and community. Down on the low end, 1, 2, 3, they should be out cave shopping because maybe they're a hermit. And if they're at 25, that's the super social butterfly area. So how are they doing with finding appropriate support for their pain management? Who do they have in their life that's not enabling them, yet supporting them in a healthy way? What are they doing to socialize with people? How are they with setting assertive limits and boundaries with people? Those are all the areas I want to discuss. So once they pick a score, I ask them to, again, defend your position. Why did you pick that score? And then we move into the fourth area, the spiritual area. On this one, spirituality is different for everyone. You know, there's a difference between religion and spirituality. But the spirituality is their connection with their inner self or their higher power, whatever their beliefs are. Down on the low end, that means they're totally cut off. And on the high end, at the 25, they're in total harmony. So I ask them, what is your score and why did you rate it that way? Now there's a possible 100 points on this. When people first come to me, their scores can be anywhere between 30 and 50, let's say. I tell them our goal is to get you up between 80 and 85. That's a very good functioning level for people. Now, it's really important that in addition to this, they have an appropriate and safe medication management plan and a way to use non-pharmacological pain management interventions, especially for pain flare-ups. If people do a good job in each one of these areas, they're going to see a tremendous difference in their quality of life. I really want them to get this, so I have them as an assignment. Pick the quadrant that has the lowest score, and between now and our next session, let's figure out something you could do to bring that score up. Then we'll pick another one. I want to continuously keep them working on calls to action, is what I call them. In other words, working between sessions. I believe that freedom from suffering is everyone's right, but it's also their responsibility. They need to be active participants in their own healing process. And I believe my job is to be a coach and a guide, and to guide them along this journey to freedom from suffering. Thank you.